Joining me right now with reaction, specifically when it came to the health care part of this speech, we have a member of President Trump's cabinet, Health and Human Services Secretary Alex Azar. Secretary Azar, good to have you here tonight.
Trish, it's great to be with you again. Thank you.
So there were some important health reform issues that came out. He talked about insurance reform. He talked about drug prescription reform. Walk us through the highlights there, because these are some issues that have been pretty important to him all along.
Yeah, you know, the president laid out today an inspiring agenda that I think everyone ought to be able to get behind, whether Democrat or Republican. Really three key elements. First, we've got to tackle the issue of prescription drug prices. We've got to get out-of-pockets down for our seniors, and we've got to get list prices down. Second, we've got to increase transparency in a healthcare system. He made a very bold challenge to hospitals, to pharmaceutical companies, and to insurance companies that they need to make their prices transparent in our system. And third, he laid out a bold and historic vision for the future of healthcare in America. He will end the HIV epidemic in America within 10 years. He's going to tackle childhood cancer, and we're going to protect pre-existing conditions. So just a comprehensive, bipartisan, sweeping health care agenda for the American people.
Do you anticipate much sort of backlash from Democrats on some of the things? For example, his proposal that we have a more transparent system when it comes to pricing, because why is it that somebody in Europe, say, pays a whole lot less for a drug than we do in America? And why do Americans not really know how much specific drugs cost, whether that be that they're not getting the proper information from the insurance company or the hospital?
Well, you know, the president called explicitly for Congress to take action to end foreign free riding. We are paying 180% of what Europeans and Japanese pay for the exact same drugs. And the president has said that has got to end. The foreign free riding must end now. He also called for transparency around drug pricing, and that's something we proposed just last week, getting rid of these kickbacks that drug companies pay to middlemen and that patients are not getting the benefit of when they walk into the pharmacy.
It's going to make some lobbyists rather angry.
Prices. Yeah, they're not going to be happy. Those who defend the status quo simply cannot be happy with anything the president is proposing on health care. Because how can you be satisfied with the status quo in health care? And the president isn't, because he knows America's patients are hurting and he wants to reduce cost and improve quality for them.
Very interesting stuff. Secretary Azar, it's great to see you again. Thank you so much for joining us tonight.